Mastitis is a common condition that affects many breastfeeding mothers. It occurs when the breast tissue becomes inflamed, usually due to a blocked milk duct or bacterial infection. This can be a painful and uncomfortable experience, but with the right knowledge and treatment, it can be managed effectively. There are several potential causes of mastitis. One of the most common is a blocked milk duct. This can happen when milk is not fully drained from the breast during feeding, leading to a buildup of milk that can cause inflammation. Other potential causes include wearing tight clothing or bras that restrict milk flow, using a poorly fitting breast pump, or experiencing stress or fatigue that can affect milk production. Symptoms of mastitis can vary, but often include redness, swelling, and tenderness in the affected breast. Some women may also experience a fever, chills, or flu-like symptoms. It is important to seek medical attention if you suspect you have mastitis, as untreated cases can lead to more serious complications, such as a breast abscess. Treatment for mastitis typically involves a combination of self-care measures and medical interventions. One of the most important things you can do is to continue breastfeeding or pumping from the affected breast. This can help to clear the blockage and reduce inflammation. You may also find relief by applying warm compresses to the affected breast, massaging the area gently, and taking over-the-counter pain relievers. In some cases, your healthcare provider may prescribe antibiotics to treat a bacterial infection that may be causing the mastitis. It is important to take these medications as directed and to finish the full course, even if you start to feel better before it is completed. This will help to ensure that the infection is fully cleared up and does not return. In addition to antibiotics, your healthcare provider may recommend other treatments to help manage your symptoms. This may include using a breast pump to help drain the affected breast more effectively, or using a lactation consultant to help improve your breastfeeding technique. It is important to follow your healthcare provider's recommendations closely to ensure that you recover fully from mastitis. Preventing mastitis can be challenging, but there are some steps you can take to reduce your risk. One of the most important things you can do is to ensure that your baby is latching properly during breastfeeding. This can help to ensure that milk is fully drained from the breast and reduce the risk of blockages. You may also find it helpful to vary your breastfeeding positions to help ensure that all areas of the breast are being emptied effectively. Other potential prevention strategies include wearing loose-fitting clothing and bras that do not restrict milk flow, avoiding tight straps or underwire bras that can compress the breast tissue, and taking steps to reduce stress and fatigue that can affect milk production. It is also important to practice good hygiene, such as washing your hands before breastfeeding and keeping your breast pump clean and well-maintained. In conclusion, mastitis is a common condition that can be painful and uncomfortable, but with the right knowledge and treatment, it can be managed effectively. By understanding the causes, symptoms, and treatments for mastitis, you can take steps to reduce your risk and ensure that you recover fully if you do develop this condition. If you suspect you have mastitis, it is important to seek medical attention promptly to ensure that you receive the appropriate care and support. With the right treatment and support, you can overcome mastitis and continue to breastfeed your baby successfully.